My name's Carrie Siegel, and I'm a professor of radiology at Washington University in St. Louis. I'm in the abdominal imaging section, and my area of interest is genitourinary radiology. A patient is supposed to have a CT scan. You are going to have a CT scan. What should you expect? First, you're going to arrive in the radiology department. You're going to be asked to change into a gown, remove any metal. You're going to lock up your items, and you're almost always going to get an IV. At this point, being honest, you're probably going to have a little bit of a wait, 15 to 30 minutes. We don't always run on time. We actually run closer to on time first thing in the morning. The technologist will call you and go over just a couple questions to make sure you're not a person that has an allergy to iodinated contrast material. And they'll bring you into the CT suite and they'll have you lie on the CT table. It is extremely hard and uncomfortable. Luckily, you'll only be there about 10 minutes. During the exam, the contrast material will be injected by a power injector that'll go right into your vein. And different patients feel different things. Some will feel sort of a warmth either in their arm or going through their body. And some patients will feel sort of a peculiar, even sort of mildly unpleasant taste in their mouth, sort of a metallic taste. Very rarely patients will feel a little bit nauseated or cough a little bit, but that's rare. Rarely patients will also be asked to drink oral contrast prior to the CT. If you do, it tastes fairly unpleasant. Some departments will put either powdered lemonade in or give you a peppermint candy to try to improve the taste. I think it does very minimal improvement. But if they have you drink the oral contrast, you'll do that, and then they'll wait about 30 minutes for the CT. After your CT is over, you're going to get dressed and head out of the radiology department. Your CT scan will be read the same day. Now, probably the most important thing I can say to you as a patient, me speaking as a radiologist, is to bring all your old exams. If you're going back to the same imaging center you've always gone to, and they have all your imaging studies, we're good. You don't have to bring anything. But if you happen to be switching physicians or different imaging centers or complete medical centers or even states, it's very important you bring all of your imaging studies and give them to the referring doctor, that all those are uploaded so that the radiologist has access to all of them. Super important. Sometimes when we're reading scans, we'll bump into little tiny things, a little tiny pulmonary nodule. And if I know it was there 2 years ago, I know it's benign and I don't have to worry about it at all. And if I bump into something like a small liver lesion and it hasn't been there before, maybe I do need to worry about it. So the prior studies are really critical. Now, if at any point while you're in the radiology department, you want to speak to the radiologist, ask the technologist. We actually enjoy speaking to patients. A lot of times we're in a room right around the corner, and you might have a particular question for us. We like meeting and talking to you, so ask if you want to talk to us. If you live far away, you will likely be scheduled to meet your referring physician, who will be either a medical oncologist, a urologist, or radiation therapist the same day. What usually happens in that case is your CT is going to get flagged to move to the top of the list. So we read that right away before you make it to your referring provider's office. So what we'll do is when we see that that's being flagged, that you're going to your doctor's office, that'll be the next CT we'll read. We'll read it, and then we'll usually call to your provider and speak to them for a minute or two. And they'll usually be about a 1 or 2 minute conversation, which is actually very valuable going in both directions. I'll say, there's a new lesion in the lung base, and the provider will say, gee, the patient's had a cough. And maybe we'll discuss whether there's a small pneumonia or an aspiration pneumonia brewing. Or the referring doctor will say, our blood test just came back and the patient has a white count. And I'll go back and look one more time to make sure I don't see an infection. So that sort of back and forth for that sort of 2-minute conversation, there's a lot of important information that's transmitted between the radiologist and the doctor that's ordered your tests. Once we've done that, you will then go into your doctor's office, and you'll have your appointment with them, and they will discuss the results of your CT and any other important information related to your clinical care that will be happening during that meeting. So that's sort of my nutshell of what's going to happen when you have a CT.